Bueno, ya sé que estáis todos acá.
I know that you're all exhausted. I think that we really want to conclude this meeting. So, well, I've been sent some words to read here a note. Someone from the board, please, would you like to read the FEDES note? Oh, good afternoon. My name is Rocío, and I'm a patient from Wilson's and a member of the association. You know, I'm the FEDERS, the Spanish Association of Families and Patients. We are part of this association. I'll work on behalf of FEDER, and they start to thank the board, the foundation of Amor, per Amor al Art, and the Biomedical Research Valencian organization for creating this meeting and talking a little bit about the Spanish Association of Families and Parents of well, we represents the force of 442 organizations of patient organizations sharing the mission of promoting the rights of those who live with rare diseases. The Spanish Association, the Wilson Association, is one of them, and since 2000, it's a joint FEDER, the umbrella association, so we've been working together for over 20 years. This is more than 20 years fostering projects and services that are indispensable for the families living with this condition. As for the work of FEDER, the umbrella association, in Europe right now we have 6,528 rare diseases, and we estimate that we're talking about over 7,000 in all over the world. Only 20% of them have been investigated, and in most of the cases it's thanks to the leadership of the patients and the commitment of the research community. Here today, as you well know, the associational movement is not just a question of money. The patient associations have become a drive for research, fostering studies, participating in clinical trials, and cooperating closely with research centers and healthcare professionals. This movement goes beyond of giving money, basically, also adds knowledge and information about the real needs of the families and of the patients, as we've been able to see today. The boosting of this research will help us to face two more challenges also dealt here. First, the delayed diagnosis that in Spain is over 6 years, a long period where patients and their families go through misdiagnosis and tests. And those who are lucky enough to get the right diagnosis face the following problem: the scarcity and difficulty of treatments for rare diseases, because only 6% of these conditions have a pharmacological treatment. And in our case, we are highly privileged since we have the drugs to treat the disease. We have 147 orphaned drugs authorized for its commercialization in Europe. Only half of them are being financed by the Spanish health system. So you're setting a great example. This symposium is a clear model about how, from the associations, we're leading the generation of knowledge and we share it. I'd like to share all the people that come here together with us in this battle with rare diseases. The cooperations among patients, families, professionals and scientists is crucial to keep advancing in research, diagnosis and treatment. Your will is key to advance in rare diseases, working next to the patients and making possible advances such as the ones that you've been able to see today. Thank you very much.
All right, so these words that FEDER wrote is thanks. All of this is thanks to you. I've been involved for 5 years, and we're here for you. Whatever you need, whatever you need. And I'm addressing not only patients and relatives, but clinicians and researchers too. We're here for you. Also, an announcement, and it's that lady's fault over there, because she had this brilliant idea, which is to be involved in the National Federation of Patients who've undergone liver transplantation. Some of our patients are not Wilson patients, but liver transplant patients, and we're going to be involved in the board of directors because apparently they don't want me to, catch some rest, and they keep making me be involving me in all this. No. I don't like messes. I like sweets. I left a moment ago for my insulin, but I'm good now. Anyway, so I'd like to thank our sponsors. Thank you. We're there with AITER, FEDER, Barma. You guys are there, Ultrageni, Farolam, and Biosabor tomatoes, and we have Rubio Dlalmata, and we love to be here in Valencia. It's probably Carmen Espinós' fault, and Susana is also to blame. We're here in Valencia. It's just they make things so easy for us that we have no other choice than to come here to Valencia. Some of you were saying, hey, why don't we change cities? I'm going to spill the beans. Next year, we'll probably meet in Madrid. I told Susana it's only going to be one edition to change of site, and because there are tons of people from Valencia who help a lot, and I've realized, the association has realized, and you too, that Paloma Jara was involved in this, and she was always there for us. Conchicasa knows this. Amparo Maudo, you know this. She's always been there, but she's retired. And there are many Wilson patients in Madrid. But we need these meetings because the clinicians gather and ask each other questions, and that's fantastic. And we realized that it was better to have doctors in the room to speak amongst yourselves, because you speak the same language, and that's what we want to do in Madrid too, because they're very, very good doctors there. I'm sure that they have tight agendas, families to take care of, and if you have to use one of your weekend days to attend one such event, if it's in your city, well, it might happen. If it's not, I'm not sure. Where's Teresa? Teresa offered to put this together, and of course Susana is going to help organize this in Madrid, and we'll do whatever it takes, wherever it takes. And if my wife divorces me, it's your fault. Mari Carmen, she is looking elsewhere. Anyway, so I don't want to take up too much more of your time. Let me give the floor over to Susana Lloret to close this wonderful day. I think it's been a fabulous day. And Conchi Casas sometimes forgets to mention, well, you told me, huh? You told me that. But I remember that picture in Valladolid. In this hotel, there was this staircase. There was 7 or 8 of us. And look at how many people are in the room now. So we must be doing something. Look at the turnout. So I'm sorry, you're going to need a bigger room. So here we're it's a tight fit. Anyway, Susana, you have the floor. Well, I have 1 year ahead of me. I'll think of something. It's an honor to close today's event. For those of you who attend for the first time, you will have realized what a tight community this is. It doesn't matter where we come from, what we do, whether we're relatives, patients, clinicians, or researchers, everybody is welcome. And we're more every year. And we've had Aurélie coming from Paris, Esther from Barcelona, Santiago. I'm not going to mention everybody here. Pasquale. And also Ala Abtab from England. We have people who've come from Germany. So what I'm trying to say here, and of course us, us, I mean patients and relatives. What we're seeing here is that attention is paid to Wilson's, and we're advancing, we're progressing, that we all have to do our bit, as Gloria very clearly put it. And like they do when we call them. So I am left with the impression that there have been achievements. We heard that we have a European guidelines that allows for shared protocols, which is of the essence for both the medical community and patients, because everything is done with clarity and it has an impact on quality. And we've listened to a number of talks, including one on the connection with skin diseases. It's the first time. Then the psychiatric side of things. It's important. I had not seen this addressed earlier. And also the impact on the GI system, because we are advancing in terms of growing our scientific medical society, but other domains allow for a greater clarity and encourage the addressing of different aspects, let alone everything that happens outside during the breaks, during lunchtime, sharing our problems, concerns with other patients, other relatives, and physicians. What a great satisfaction. I'd like to thank the association. I did not meet Conchin, but I did meet Amparo. I'd like to thank all the physicians, all the researchers who bring hope. Thank you for sharing. And I'd like to thank the patients, their family members, because you make this happen. You're the leitmotif of everything. Thank you. So we'll see what we can do next year to advance, to progress. So I'm really grateful. Thank you. And this is your home. This will always be your home next year and beyond. Thank you. Okay, so you made me do what I now have to do. So now you have to come up here and say something. Is the mic on? Do you want to come on stage? No, I don't want to. I'm here in my corner, so I'm fine. I don't have much more to say. I'd simply like to reiterate my gratefulness for those coming from abroad, from other cities. This event has been put together for you. I hope it made sense, and I hope this encourages you. For me as a researcher, this is a morale booster, because oftentimes we don't get the lab results that we want. And lab work is like a roller coaster. You have peaks and delves, and it's life. There are numerous delves, and in this country, when it comes to research, those delves, those valleys are deep. But this is still a morale booster, because what I do makes sense, because I work alone by myself. And thank you. Thank you. I'd like to express my most sincere gratefulness to the speakers for accepting our invitation. I will insist with other speakers. We'll try to share breakthroughs, novelties, both domestic and international, to see what is happening in Europe in terms of research and clinical practice on Wilson. Thank you very much indeed. Faustino, I want to go home, I'd rather, give the phone. What phone? Not the phone, the mic, Clara. Me? Well, yes, you were here from the get-go. Since Fisabio, you've been with us. Yes, and since last year we signed an agreement with Fisabio, and the Regional Ministry of Health is encouraging agreements among practitioners and patients associations, and the Cancer Association is very powerful indeed, as we've heard, but this increase in agreements is good. We've signed 2 with rare disease patients, all thanks to you, and this is huge, and the involvement of patients and relatives is wonderful. You always help, you always support us, so thank you, and I hope to see you in Valencia in 2 years' time.
No. Ya sí es verdad.
Faustino, come on. No. We have to thank Claire, who's come from the UK representing the Patient Association. Thank you. I would like to ask the speakers to join us on stage, and for a group picture, and once that picture is done, let's have a picture with everybody. Let's start with the speakers. What? Yeah. All right, let's do this.